I'm very careful not to make specific suggestions until I've been able to tease out from my patient what it is that bothers them. I am not the type of doctor that dictates. I'm the type that listens and then tries to create a treatment plan based upon what your concerns are. So if someone said to me, fix my face, my answer would be, there's nothing wrong with your face. Then, of course, with the banter ending, we'd ultimately try to pinpoint what are the issues that they have. I think in general has been a trend over the course of the last 10 years or so to be less plastic in plastic surgery and to try to just enhance more of someone's own natural beauty rather than trying to alter it to fit a specific mold.
Today, I'm here to have oral therapy because at this time I felt that I was not ready to undergo a facelift. I didn't feel that I wanted that at this point, but I did want some tightening around my jaw, my neck, and some lift around the eyes. Just something that would look natural.
Essentially, most of the patients would show up and say, what can I do to make my skin look better? And like I said, other than staying out of the sun and not smoking and moisturizing, then we have exfoliation. And most of what we wind up doing in a medical spa practice is exfoliation. They're offered these choice of treatments from light peels to microdermabrasion to more aggressive peels to laser, and laser can be very non-aggressive laser or very, very aggressive laser. And we discuss all the choices and we try to meet the patient's expectations.
I was diagnosed with breast cancer and I needed to have them removed. And I looked around and I went to a couple of places, and one of the first places I walked in and I felt like I was walking into a spa where they had the incense burning and the candles, and I walked in and I was thinking to myself, I'm not here because I want to be, and I'm not enhancing what I have. This is something serious. And I walked into this office and it had a wonderful feel to it. I felt that it was a doctor that was going to take care of me. I came in with an entire 2 pages of questions, and he went through one at a time with me, every single thing, answered every question, and made sure that I was clear on everything. I didn't feel rushed. I felt that he wanted to make sure that I was going to be okay.
Many of the procedures that we're doing are ambulatory procedures, so that the patient is coming in, having the procedure done, and then recovering for a short period at the facility, and then they're most often going home. And oftentimes patients also prefer that because the comfort of their home environment is much nicer than being in the hospital. There are certain times, depending on the extent of the procedure, that we will have the patient admitted overnight to a hospital, or sometimes even consider an extended stay, 2 or 3 days, depending on the extent of the procedure. In all those cases, there's a very close follow-up. So if the patient's admitted to the hospital, I myself am seeing the patient directly every single day, if not more than once a day.
I had a ligament injury that needed to be reconstructed. I couldn't use my hand. Over time, I could use it less and less, and it started to be painful. And so I went to see Dr. Patel to see what he could do for it. When I went into the OR, I was completely relaxed. All my vital signs were like as if I was taking a walk in the park. I just complete faith. I trusted him 100%, and no doubt I had every reason to trust him. He saved my life, really. I mean, I'm right-handed. I need it for everything I do, and I can't say enough about him.
He was wonderful throughout the procedure, and the staff was wonderful, and I felt very happy with the results.
I knew after I left here that there was nobody else who was going to be doing my surgery.
We at Samra Plastic Surgery really believe that the patient is the center of the journey together that we take, that they are the captains of their own ship, and we are a part of that, but we don't necessarily direct the treatment. We guide them to make decisions that are personal to them based upon the specific complaints that they have. We have a very caring staff. We have a very comfortable office. We spend our time with patients. We don't want anyone to feel rushed, as this is a very personal time and sometimes a difficult time to actually address some of the specific concerns that they may have. And I feel that my patients become part of the Samra family in a way. And I hope to continue to provide that care to all of my patients, and I know that the other physicians feel the same as well.